You earned an MBBCH from the University of, and please forgive me if I mispronounce this, but the Witwatersrand Medical School.
Witwatersrand Medical School.
There we go. For our viewers not familiar with medical education in South Africa, I'm certainly not, what was that experience like?
Training in South Africa was really a sort of a mixture of training in a first world country. We, in the big cities, doing major surgery, as was happening in this country. But then in the more rural and poor areas, there were also really patients that had the diseases of third world countries. So there were outbreaks of typhoid fever, diphtheria, and those kinds of infectious diseases that one really wouldn't see in a medical training in the US. I sort of grew up in the height of apartheid political times in South Africa, and it was not where I wanted to bring up my children, my family, and so decided to emigrate. And then the other reason was I really wanted to subspecialize in the Americas, where there was the most sophisticated medical training system that I perceived.
Sure. Your responsibilities as a physician aren't just to children. They're to parents and to families as well. How do you approach comforting them at critical moments?
I take my lesson from that portrait there. I like to sit at the patient's bedside with the family. I think it's important to engage a family with kindness, with respect. I think one has to be aware of perhaps certain religious or societal customs when speaking with families. We at this hospital have patients who come from all corners of the world with different cultural expectations. I think it's important to use a vocabulary that people will understand. We have parents with a range of educational skills and backgrounds, and I think one has to really tailor one's conversation to a specific family. I think it's often not only parents that we are talking with, but also grandparents, uncles, aunts, extended families. Sometimes people have a sort of perception of an anesthesiologist as really a non-clinical person, a person who doesn't have interactions with families, but anesthesia doesn't start in the operating room. It starts in the preoperative area, where I like to sit down with the parents and get again a thorough history, perform a thorough examination on the child, and then to talk to the family about the medical issues, perhaps the surgical issues, and then, and sort of really only then, to talk about how we're going to do the anesthesia.
Sure.
So there's a lot that precedes actually the issues of anesthesia. It's much more making connection with the family.
Right.
They're really, when you think about it, they're putting into our hands their most precious, valuable child.
Dr. Berkowitz, thank you very much for your time.
Thanks, Ian.
That was a CLOSLER Look.